All right, let's talk about the scalenes. So the scalenes are on the side and the front of the neck, and they can be very troublesome muscles in lots of people. Um, and their trigger points can cause all kinds of pain and problems anywhere downstream on the arms. And they're a good muscle to check out anytime anybody has any head, neck, arm, thoracic outlet, all those kind of issues. So let's take a look at them in general, and then we'll get specific with them, and we'll also start to massage them, because like the SCM, these can take a little more practice. We will practice with them on Monday's lab for thoracic outlet syndrome. And during this little mini lecture, we'll take time to palpate them as well. So the scalenes are a group most often referred to by anterior, middle, and posterior, but about 40% of the population has an extra scalene, and that's not usually referred to, but all of them, because they can attach to the first or second rib, and then the extra one, it can also attach down to the pleural fascia. These can all also be an issue when people are stressed out, because we often do upper chest breathing, and also anytime we're doing a lot of coughing, or just even the elevated shoulders, we often engage our first and second rib in that activity. So when I say upper chest breathing, just to clarify, like really, that's anybody who is not taking nice deep breaths, all the way using their diaphragm, all the way down into their belly. So really, this is a lot of your clients and a lot of us here today end up kind of doing like a stressful upper chest breathing. And, the scalenes, they get involved in that. So first thing I want to point out on this page, before we go to the origin and insertion, is that between the anterior and middle scalenes, the brachial plexus emerges. So I'm going to highlight that right now, kind of in orange. And so, of course, implications for this are that both the scalenes could easily press on the brachial plexus, or when you're massaging them, you could easily press on that. So this is just review, but what kind of signs and symptoms might we have if the nerve is pressed on? I hear
tingling, numbness, sharp shooting pains.
Sharp shooting pains. Excellent.
Numbness.
Excellent. But remember, when you're working with your client, that sometimes if you don't tell them ahead of time, they might assume that, you're just kind of working out some tense spots. And so tell them ahead that if they feel any numbness, tingling, sharp shooting pain, they should let you know. So we will study thoracic outlet syndrome on Monday, but I'm sure some of you are interested to know, right, if the brachial plexus emerges between the anterior and middle scalene, what is the rest of its pathway? And we'll come back to this again Monday, but just let's take a look that this superhighway of nerves, our brachial plexus, when it comes out between anterior middle scalene, it then dives deep to the clavicle, and then it dives deep to, who recognizes this muscle?
Teres minor.
Thank you. Pec minor.
Pec minor.
I'm so sorry. Yes, pec minor.
Pec minor, yeah. Thank you. So then we go under pec minor. So that's the full course. And so, we could be trapping this nerve bundle here with the scalenes, with the clavicle, with the pec minor, and then sometimes even people have an extra long transverse process at C7. So even that bone could be pressing on it. Now, what do you notice is happening here? The yellow is the bundle of nerves, the brachial plexus. What do you notice is traveling with it? Right next to it, following the same course, what do those appear to be?
The artery.
Yep, we got an artery going right with it.
Subclavian artery.
Excellent. And then what is the blue one?
Is
A vein. Beautiful, beautiful. So like I've said on many occasions, major arteries and veins and nerves are often bundled together. So implication on this is that, you know, you might be, this might be compressing arteries or veins at the same time, right? So you might not just get nervy symptoms. You might get, you know, the vessel symptoms as well. All right, so let's get back to the scalenes. Okay, so we are going to focus on anterior, middle, and posterior, and just kind of tuck in the back of our brains that about 40% of people have an extra scalene. Let's take a look at the anterior scalene first, starting with origin. So the origin of the anterior scalene are transverse processes of the 3rd through 6th cervical vertebra. So the other way to say that is C3 through C6, and that TVP is transverse process. So the other way to say this origin are the CVPs of C3 through C6. And specifically the anterior tubercles. And let's take a look at what that is after we go over all the O, the I, and the A. So the insertion is the first rib. And believe it or not, this is actually pretty palpable. It takes a little practice, which we will do on Monday. But very close to the transverse processes. I'm highlighting it on the upper drawing right now. Very close to it, you can feel the upper, the first rib. And that is not easy to do on yourself. It's not easy to do sitting down. So that's something that we will practice on each other in lab. And I accidentally drew that in red, so I'm just gonna correct that and do that in blue because that's the insertion. That's better. Okay, and so that's the insertion. Now the actions, the scalenes act together, but we'll talk about it. So unilaterally, one side at a time. The right scalene can laterally flex the head and neck to the right side. So lateral flexion, ear to shoulder, same side, and rotate the head and neck to the opposite side. So what does that sound like it's a synergist with in that lateral flexion of head, rotating to the opposite side?
Sternocleidomastoid.
Awesome. Yeah, sternocleidomastoid. Beautiful. And bilateral is actually also, so it's a complete synergist with sternocleidomastoid. We can elevate the ribs during inhalation and flex the head and neck on the anterior ones. So I'm going to switch views here and show you some cervical vertebrae to talk about these anterior and posterior tubercles as far as palpation is concerned. All right, so here I have some life-size cervical vertebra on the left, And at the moment, of course, we're looking at a posterior view, and we can tell that because of the spinous processes. Now, if I was to turn these to the side, and now, of course, here we have posterior on the left, anterior on the right, and that is in alignment with what we're looking at right here. What I want to point out to you, because this is relevant for massaging the scalenes, is that the transverse process are much thicker than you might imagine in the cervical region. So this is a life-size model, and I'm putting my finger on the TVPs right now. And as you can see, it's really as thick as my fingers. And so these anterior tubercles are the part on the front, and the posterior tubercles are the part on the back. And with practice, you can actually isolate the difference between coming up here on the front and coming up here on the back. And why I'm really pointing this out is because we do have different scalenes attaching on the anterior tubercles and posterior tubercles. And if somebody didn't really understand transverse processes, you know, I could see that it might be natural to just come at them, you know, kind of right on top of them. But to really get those muscles, you're kind of coming at them a little bit from the front and a little bit from the back as you're coming on top of them. And we will palpate all of these on ourselves right after we get through all of the scalenes. All right, so let's move on to the posterior, middle and posterior scalenes. So starting with the origin, transverse process or TVP on the middle scalene of 2nd through 7th cervical vertebra. And now we're talking about posterior tubercles. So, and again, the other way to say this would be the TVPs, transverse processes of C2 through C7. And then that's our middle scalene origin, and then our middle scalene insertion is the first rib. And again, this is palpable. It doesn't really look like it when you're looking at diagrams, but it's right next to the TVPs. So we'll practice that on each other on Monday. And same actions that we went over with anterior scalene and same actions as sternocleidomastoid. So our posterior scalene originates on the TVPs or transverse processes of 6th and 7th cervical vertebra on the posterior tubercles. So as you can see, these ones are originating lower, and they insert on the 2nd rib, and again, that is lower. Now, that one is really too deep to be palpable, but we can palpate up here on the tubercles. So having said that and kind of walked you through with the model, let's take a little time right now just for some introduction to palpating these, and then we'll practice more in lab on each other. So like sternocleidomastoid, but even more so with the scalenes, you're going to want to use flat fingers. Of course, we have the brachial plexus in here, and we don't want to dive deep. Now, unlike SCM, so with SCM, we can really grab that muscle. That's not going to be our approach with the scalenes. With the scalenes, what you're going to do is you're going to go right under your earlobe, and you're going to use flat fingers and palpate anterior and posterior to feel to start feeling those TVPs or transverse processes. Now, use flat fingers and be aware that with tight muscles and all, and there might be some trigger points in there, you might hit some very tender spots. If you feel a pulse or sharp shooting pain, tingling, anything like that, of course, move and stop what you're doing. But if you slowly work your way down, you'll start to feel this kind of a ridge or kind of like a mountaintop. And if you start to isolate that, then you can start feeling in front of it and behind it for that part of your scalenes. And we'll take a few minutes to do that. I'm going to pause the recording while you take your time with that. But now that you've felt the TVPs, just know, now that you felt the TVPs, also with flat fingers, now you can kind of come down anterior to trapezius. And in this area, you know, superior to your clavicle.
Can't really see your neck very well. It's like it's too high.
It's too high.
There
That's
you go.
weird.
Now I can see you.
Okay. So in front of your traps and superior to your clavicle, flat fingers only, and don't press perpendicularly in this area. But if you go side to side, sometimes you can feel some very ropey muscles in there. So yeah, I'm hearing some, yeah. So that's part of your scalenes there. Now, in lab, we will get more specific because sitting up on yourselves, you're not really going to be able to feel your first rib. So you'll actually be able to work with other people's scalenes better. But this is, you know, kind of a good way to start. And so you should be behind your SCM and in front of your trapezius. And you have an area here where you can get to your scalenes. And I will take that work with my clients all the way up the clavicle. And in this whole area, you're going to get into SCM, you're going to get into platysma, but there can be a lot of tension. Now, of course, this is a vulnerable area. And so obviously we're not digging in deep, right? And it's a good area to just work one side at a time. You know, so you're kind of doing a lot of like myofascial release where you're kind of getting hold of the tissue, you know, and then bringing it to the side. You're not, you know, obviously you're not poking it in those areas. Yeah. So questions on those? That's just a starter. That's just
feel that as well as I did the SCM and stuff.
You cannot feel it as well.
Mm-hmm.
Is that what you said?
Yeah.
Yeah, that one I think will be better in lab on each other with our heads resting on the table. So we'll take our times with that one in lab.